All right, everybody, welcome to the Retire Well podcast. We are your hosts, Alicia Kay, Julie Lampe, and Patricia Coloca Massote. We are offering a fresh and comprehensive perspective, helping you see retirement through a new lens. We are three female entrepreneurs from Central Florida who are passionate about serving the pre-retirement, post-career adult. We are so lucky to have probably our most credentialed guest yet on the show, Dr. Accardi, who is a clinical pharmacist, and I'm going to have his dear friend Patty introduce him.
Well, so I am so excited to have you with us, Dr. Accardi.
I'm delighted to be here, Patty.
Yeah. Thank you for taking some time out of your busy life to be with us. That means a lot to us. So what an honor. So yeah, how did we meet, Dr. Accardi? We met, I think it was about last year, right?
Yes, about that.
You were introduced, and I specialized in, pretty much working with people on Medicare, right? And we've been working together since. I think you have so much to bring to the pre-retiree population as well as those on Medicare. And I think I would like for you to introduce yourself. I want you to tell us a little bit about you, your journey in pharmacy, and what you have to offer as far as education, right, to those.
Thank you. I'd be happy to do that. Let me preface, however, to say that meeting you, Patty, was one of the better things that's happened in my life. Besides being a superb tennis player, your knowledge base is just extraordinary. And I think you are so valuable in today's day and age with all the convolutions and changes and hyperbola about what is available, what services can be obtained and affordable, and it just gets very confusing. I think that's really how we first met, is you clarifying many pieces to me. And I just find your knowledge invaluable. You help ensure that the individual, in my case it was myself, get what I need. Be it coverage on my medications, my labs, my MRIs, or whatever, to be sure that they're inclusive and yet affordable, and that you don't have restrictions as to what companies you can represent. You represent the individual, and yes. I just find that remarkable that you're able to do that. And what I still can't fathom is that I, the client, I don't have to pay for any of that.
I love it.
I find that incomprehensible, but because I wanted to pay you, and you said, nope, you don't need to do that. I think it's quite extraordinary. Coupled with your extraordinary knowledge is your kindness. And so having you as part of my team is just an invaluable couple. So I'm delighted. I am a fourth generation pharmacist in the Accardi family. We've been practicing community practice since 1957 in Central Florida. I am the third generation, as was my brother. And there's a fourth generation, that's Dr. Shannon Miller. She's the smartest of all of us, as it should be. She works at the University of Florida College of Pharmacy. She's an associate professor, teaches a myriad of pharmacy classes, and is an administrator. We've been at this a while. She talked me into going back to school in about 95 to get my doctorate in what's called clinical pharmacy. What is that? Clinical pharmacy is the hybrid combination of pathophysiology, understanding disease states and what breaks down, and pharmacotherapy, which is then aligning the appropriate medications to the pathophysiology. What all that means is if you got heart failure, or you got diabetes, God forbid, whatever it may be, that I can help you align the appropriate or optimal medications to maximize outcomes. And the second part, equally important, is to minimize the risk. Every medication has a risk-benefit ratio. And so one of my responsibilities to you, the patient, is to minimize the risk and maximize the efficacy or outcomes. That's pretty much what I do.
Wow. That pretty much explains it, right? And you forgot to say how much fun you have, you know?
Yeah, we do. We have a good time.
So let me ask you a question. Okay, so
Sure.
if you could go back a few years, right, or you're talking to a friend that's about to, you know, turn 65 or it's approaching retirement, what would be those top 5 things that you would share with them in regards to pharmacy or, you know, medication? And yeah, pretty much that. I think that would be the first question for you.
Oftentimes when you ask an individual, someone of that, in that age bracket, tell me what your pharmacist does. What does he do for you? And the answer, more times than not, is, well, he fills my prescriptions. May I ask what else he does? Do you interplay with your pharmacist? Does your pharmacist know anything about your overall medical history? Does he share with you knowledge about the medications themselves, what the risks are with those medications, and what to look for if things begin to go south? And generally the answer is no. So in clinical pharmacy, we do that. That's actually the essence of the practice. No two people are alike, and how you react to a medication may not be the same as the majority of the people that take it. How do I get that information to you? We set up consultations, and we formalize the relationship. I could fill a prescription for you. For example, you have osteoarthritis. The doctor writes for you. The diagnosis is accurate. Writes for you some anti-inflammatory medication, which is appropriate. And yet, even though the diagnosis is accurate and the medication is accurate, could still have dismal outcomes, horrific outcomes. Well, how does that happen? Because it's the interplay of you, the patient, with that medication that defines its outcome. There are variables: your weight, your age, your size, your adherence. Do you take the medications as they are prescribed? Do you know what to do if something unusual begins to occur? Does that have meaning for you? So it is that surrounding information that really defines the outcome. For example, or in that example rather, you could have the beginnings of a breakdown in the mucosa inside of your stomach, the beginnings of ulcerations that are at that point, say, subclinical, or maybe even beyond. You may have spotted some bleeding, some red or black stools in the last week or 2 weeks or so, and just kind of blown that off. The reality is that that's significant, especially in the case of using these NSAIDs, the drugs of choice in generally treating osteoarthritis. They, in fact, could actually blow that ulcer out, and now you have swapped a chronic condition, osteoarthritis, for a bleeding ulcer. It's not a good choice. It's not a good gamble. So that's what we do. We try to determine if there's anything that's going on with you that, from a pharmacotherapeutic perspective, could be improved upon. If nothing else, we're going to teach you what to look for if some of these medications are acting a bit oddly from what we have told you. And most people, unfortunately, look at their pharmacist as simply a vendor of drugs. There's so much more substance. We didn't go to school for 6 years to simply count to 100. And yet the perception is that's pretty much our primary job. Well, it should not be. And it is our responsibility as a pharmacist to make you aware, to allow you to see that the guardrails are not so narrow in our profession.
Wow.
And then to avail them to you.
That was super enlightening for me. I don't know about you two. I didn't realize. So is every single pharmacist, this is sort of a ignorant question potentially, is every single pharmacist, if they're called a pharmacist, a clinical pharmacist? Like, do they have that degree, or is there a lower level of education where someone can still call themselves?
Academically, every pharmacist should or can be called a pharmacologist.
Okay.
And if you then assume that position, that by way of definition, meaning you understand how medications work, then you're in a position that you can convey that information back to your patients or to physicians when they call and ask questions about specific medications. So anyone can assume that role. Why I went back to school in the first place, I first graduated University of Florida in 1968, and then went back to school, I think it was in 95, because my knowledge base on medications needed contemporizing and needed more substance. And once that was gathered, which took an additional 3 years, then I could not wait to share that. Then my role, my reason to get up and go to work in the morning was to teach you, to show you that when you take that particular medication for your GERD, it's the wrong medicine. It's not the right way to go. It actually exacerbates the condition instead of making it better. So I could not wait to take patients that had these respective disease states and show them ways in which we can improve it. And ultimately, if I hit a home run, I improve your quality of life. That's every day's goal. And that's not happening if I just simply vend drugs.
That's true.
I think that's number one. I think a lot of people don't know how much of a resource their pharmacist can be for things like that. I know I have a good friend who recently was prescribed 2 NSAIDs, 2 at the same time by orthopedic doctors. I think 2 different doctors in the same practice. And she was like, well, I'm on this and I'm on this. And I was like, why did they? It was me. I was the one, her friend was the one that said, I don't think you should be on 2 NSAIDs. Let me check with my friend who does orthopedic nursing and see if that's like a new thing. But when I was practicing, we didn't do that. So yeah, I mean, I think that, I'm not sure where the gap happened, but it's definitely something that she could have talked to the pharmacist about. And I do see that a lot, even with my parents and my grandmother, that they tend to jump the gun on, thinking about side effects of medication instead of calling the pharmacist and having a consultation with the pharmacist first before. My grandmother will just stop taking something because she thinks, oh, that's a side effect of the medication. I'm just going to quit that new medication. And really she should be calling her pharmacist.
Yeah, and adherence is a huge issue.
Mm-hmm.
And one of the roles that a pharmacist can do, we do it in our practice, is to follow up after the medication is dispensed and to see how you're doing with it. And oftentimes we hear just that no, it made me sleepy and I don't need that. I'm not gonna take it anymore. Mm-hmm. Or they told me I have high blood pressure. I didn't know I had high blood pressure. I had no symptoms. I felt great. Now I'm taking this prescription that cost me $50 and I feel like hell. So the heck with that. I'm going to stop the medicine, save $50 a month, and I'm going to feel a lot better. Oh, really? Did anybody sit and explain to you what the outcomes of that will look like? That you chance having a heart attack, you chance having a stroke, your quality of life will precipitously drop off. So it's the education that in my case, the University of Florida mandated that I have and be proficient in it enough for them to award me a degree. And then for the state of Florida to say, yes, you are competent enough that we are going to give you a license and you're going to oversee the people of the state of Florida. Use it. And unfortunately, the vast population is not aware that that's a role that a community pharmacist can in fact practice. And that's what we try to explain, that is available. And frankly, do not do yourself a disservice and underutilize your practicing pharmacist. Now, there are some locations and some pharmacies, by the way it's set up, that are not geared for this. So maybe you have to make a phone calls to find out if, in fact, do you practice clinical pharmacy? Do you do compounding, which we do, for example, where we customize the dosings for you? An intimate relationship with that pharmacist. He can be a resource for you.
This has been wonderful. Patty, do you have any questions before we wrap up?
No, I mean, I think the biggest thing is that we want to let the community know that these are the partners that you have, now that you have this knowledge, to not only look at your benefits. You know, we're approaching open enrollment, and this is a big time of the year because a lot of these insurance plans change. Sometimes prescriptions might not be in the formulary. And this is my job. You know, my job is to make sure that, number one, do you understand what medicines you're on? If you don't know, then I have Dr. Accardi here to help you understand what medicines you're on and whether they're going to be covered or not. There's a lot of moving parts when it comes to that. So I want to help you save money, have a partner in your care that actually communicates with your doctors, because I've seen many times Dr. Accardi communicate constantly with doctors on the phone. So what amazing level of service, right? It's almost like what we call that boutique service, right? So anyway, we just want to make sure that you know that you have these services available to you.
Absolutely.
And no problem. I find I didn't even know there were people like her. All those years that I had no Patty in my life. What a wonderful augmentation, because my knowledge of insurance is virtually non-existent. And yet what a big piece that the impact that this information can bring to people of my age bracket is just, it's literally invaluable. And that she has that knowledge, and she's very kind and very sweet. Oh, and she plays tennis. Plays it well, I might add. It's just a wonderful service. It's extraordinary. I don't know what I'd do without her.
Oh, Patty. Thinking on your heart today. Wow. What a endorsement. And I mean, it sounds like you guys are just an incredible team, and it's a real important component that I think people aren't aware of. You know, we talk a lot about Patty, so people don't realize how she can be helpful. And I think, you know, with Dr. Accardi, I don't think people realize what a resource their pharmacist can be. So there's a lot of synergy there with just really educating people on including a pharmacist and including an independent Medicare expert like yourself, Patty, to be able to get people the service and products that they need for their wellness. So I think it's amazing.
Oh yeah. I'm very lucky.
As am I.
You so far. I mean, you both are just remarkable, and that was just such a fascinating last 15 minutes. So I'm excited to hear more. We're clearly going to have Dr. Accardi back, because there's just a wealth of knowledge there. But I feel like that was just wonderful way to communicate to our listeners that your pharmacist is an ally in your healthcare. And that was for me. I never, ever did the consultation. You want to talk to the pharmacist? No. I'm good. So, you've changed my perspective already. So this was just wonderful. So just thank you everybody for listening and joining us today. We invite you to subscribe to our YouTube channel, our Facebook page, and interact with us. Let us know if there's a guest you would like to have on, an expert that you'd like to have on, or if there's any particular nitty-gritty questions you've got for any of our guests. You can also follow us each individually. I'm Alicia Kay with Try Organizing. Julie is with Paradigm Interiors, and Patty is with Coloca Motion. So feel free to follow us all individually as well. So until next time, thank you so much for listening. Bye.
Bye, everybody.